Stop making this mistake when it comes to your hormone replacement therapy. Many women are experiencing symptoms and are prescribed hormones through random different providers, having random different treatments without fully understanding what's best for you based on your metabolism, your biology, and your body. Two women with the exact same symptom and the exact same hormone level can be prescribed the exact same treatments and have entirely different results. Here are the three most common ways that hormones are prescribed, and I'm going to help you choose the best one for you. First, let's talk about pellets. Pellets are rice-sized grains that are implanted subcutaneously in your gluteal region. The pellets release hormone over time based on your individual metabolism, blood flow, and cardiac output. What this means, on any given day, you're going to get the amount of hormone that's right for you based on your activity level, how much you've slept, what you've eaten, what you've drank. You're not going to get more or less. The benefit of the pellets, in my opinion, is that it allows for precision of dosing. By precision, I mean that we can calculate the dose that's right for you based on your data, and that optimizes the beneficial effect and minimizes the potential risks for side effects. The other benefit of pellets is the convenience. You don't have to worry about putting on a patch, putting on a cream. You don't have to worry about the cream transferring to your partner, your pet, or your kid. Now, here's the downside of pellets. Once the pellets are inserted or implanted, they can't be removed. If you do experience an untoward effect or a negative side effect, they can't come out. If your dose is miscalculated, if you go to a provider that isn't trained and experienced in pellets and they overdose you or underdose you, you can't remove them and you may have to be dosed again. This again is why it's really important that when you're choosing a provider that you find out, are they experienced in hormone replacement therapy? Are they looking at your laboratory values, and are they experienced specifically with prescribing and dosing pellets? It's important to understand that your metabolism affects how you will process hormones, pellets, patches, or creams. So the more active you are, the faster you're metabolized. The more sedentary you are, the slower you're metabolized. Your genes play a role in your metabolic function as well. All of these issues need to be understood by you and discussed with your doctor prior to choosing which option is best for you. Let's talk about the second method of delivery, and that's patches. In particular, we're talking about estradiol patches. A patch delivers hormone through your skin into your bloodstream, and there are very specific doses that your doctor can prescribe and select. The issue with the patch and the dosing of the patch is you get what you get, you don't get upset. If you get 0.25 milligrams, 0.05 milligrams, that's what you're getting. Your body might need more than that. Your body might need less than that. There's no variability day to day based on your metabolism and blood flow like I talked about with pellets, but the patches deliver hormone through the skin in a particular dose that's absorbed safely and effectively, and it's a perfectly good option, save for the lack of precision and save for the convenience, because you have to apply the patch sometimes twice a week, sometimes once a week. The other issue with the patches is some patients have allergies to the adhesive in the skin. It also is visible. Sometimes you can see it in your bikini. Sometimes you can see the residue left after you take it off. These are all things that you need to consider, take into account, and weigh when you're deciding which treatment is best for you and discussing with your provider. Here we go with the third option, and that's creams. So creams are my least favorite option. And the reason for that is there's absolutely zero precision. There's no guarantee with a cream, even if you're dosing it at a specific dose, that that dose is getting through your skin and into your body. There's no way of guaranteeing that, and there's no way of checking that. There's also an extreme amount of variability, person to person, how you metabolize. So for that reason, due to the lack of precision and variability, there's a higher risk of either overdosing, increasing side effects, or underdosing, not giving enough, and there's no way to calculate an amount to give. So the creams are, in my experience, in my practice, I use the creams in younger perimenopausal women with slight side effects that are just starting to experience symptoms. They're sort of like a gateway drug for people that are just starting to enter perimenopause. I also use the creams for women that are traveling and they can't make their appointment. They need something to stave them over, because with the patches and creams, there's no precision and you get this, up, down, up, down. So if you want consistent levels over time, in my opinion, the pellets are the best option. I also use the creams in women who are fundamentally opposed to the pellets or afraid of the pellets, and I'm talking about just for testosterone. I don't ever prescribe estrogen creams in a menopausal woman. I think that's absolutely not the standard of care. Okay, so you have all the information. In the end, which one should you choose? You should choose the one that's right for your budget, that's right for your lifestyle, and that's right for your metabolism.